Hello and welcome to the Aesthetics and Wellness podcast. My name is Sophie and I'm joined today by our lovely Holly, who is one of our skin therapists. Welcome.
Hi.
Today we are talking all things acne. So we're talking about what we can do to treat acne at the clinic, what is acne and what to avoid if you have acne. So Holly's been with us for about a year now at the clinic, just coming up to a year. And you became a therapist how long ago?
So I've been in the industry 5 years now. So initially from when I left school, obviously I went to go into law, but my passion was always with skin.
Yeah. And why was that?
Well, when I was younger, back in school, I did used to suffer with my skin, and suffering with acne, I know how it feels. The lack of confidence that you have, and also like the psychological effects of it as well, like wanting to kind of hide from people, wanting to cover it with makeup, those aspects of it. So I really do understand how much it can affect your life. So that was probably one of the main reasons why I wanted to be a skin therapist.
Yeah.
And also obviously share my knowledge as well, what I have with other people, so help them feel confident. I notice a lot of the times when patients come into clinic, the first thing they say is it makes them feel unattractive. And that's not something that like people want to feel. We want to make sure they feel the best.
Yeah.
So that is probably one of the main reasons why.
Why you went into skin.
Yeah.
Okay, perfect. So from a young age, you suffer with acne, and so your sort of passion behind it is you know how the patient feels. You've been through it. You have
Definitely.
that real life experience. You've probably tried lots of different products, I imagine.
Yeah.
That doesn't work.
I've been there, tried it all, and really educated myself and used the knowledge that I have today to actually clear up my skin.
Yeah.
I am human. I still get the odd spot now and again. But with that knowledge and obviously working alongside Yusra, I have eventually cleared up my skin.
Yeah. And I think that's like an important thing. You know, people will have a little breakout, and that's okay. We're human, but we're there to empower the patient. We're there to help them and give them the knowledge and expertise on how they can treat that spot if it happens. Is there an external factor? We know that there are many external factors, many internal factors that can cause acne.
Yeah, 100%. So obviously the most important thing to do first is educate the patient, because a lot of patients fall for marketing fads. They'll see the latest trends on TikTok. So we always advise to kind of stay clear of that and follow the guided knowledge that we will provide you, really.
Yeah.
So yeah, like you mentioned, there is lots of different factors, external factors, including like stress management, your diet. So you don't want to go for like ultra processed diet, because that will affect your skin. Skincare, certain skincares that you apply can actually worsen your acne. Makeup, if you're not cleaning your makeup brushes or pillowcases, things like that.
Oily makeup as well can cause
oily makeup. Yeah,
and people don't know, do they? They see, you know, the latest celeb has tried this foundation and they've got skin like glass, but actually that celeb or that influencer may not have acne, so they're then using a product that can flare that up. So I think the main thing maybe to think about is, what is acne? You know, for patients who don't know, who may get, you know, maybe suffering with acne but may not know that it is acne. What is acne? What would we say to a patient when we're doing our consultations, our holistic consultations? What are the types of things you will ask the patient? What will you go through? How will you determine if it's acne or it's just maybe a hormonal breakout? Okay,
so acne is a very common skin condition that most people do suffer with at one point in their life.
I think it's 95% we saw. So 95% of people aged between 11 and 30 suffer with acne, or will suffer with acne at some point in their life, which is huge. That's really everyone.
Yeah. So obviously it can be caused by hormonal factors like we mentioned. So when people are going through puberty, they can suffer with acne then, or obviously adult acne, when they're going through menopause, perimenopause, or even pregnancy can cause acne as well. So hormones play a huge factor in the cause of acne. So that's something to always bear in mind.
Yeah. And then so as part of your consultation, you'll obviously go through, we do a full holistic consultation at the clinic, and you will ask them, you know, you will go through with patients and try and determine maybe what is causing their acne, because if we know the root, we can treat the symptoms. If we don't know what the root is, so you do ask questions such as diet, and we can, you know, advise patients, you will advise patients if they're eating maybe ultra processed foods all day, every day, not drinking enough water, that is going to ultimately affect their skin. it's not just one thing necessarily, it's a culmination of a few things.
Yeah, so when a patient comes into clinic, we'll take a fully holistic approach and assess the skin. So what I'll start with is assess the skincare. We'll look through the current skincare routine and see if there's any mistakes that they're making there. Then we'll look at if they're using any makeup that could be causing acne, so oil-based products, things like that. Then we'll look at their diet. If they have an ultra-processed diet, like you said before, a diet high in sugars, they're not at least having 2 litres of water a day, we'll discuss that and how we can help.
Yeah.
Also, supplements. Dr Yusra always advises a zinc supplement because it's anti-inflammatory, and omega-3 because it's anti-inflammatory, and also probiotics are great. They're 3 key supplements for anyone that is suffering with acne. We'll also look at stress management as well. Stress is a huge driver for acne. So if you have high stress levels, you're going to have high cortisol levels, which then produces more sebum, which then will lead to further breakouts.
Yeah.
So that is something to really look at. I know when I have been stressed in the past, my skin flares up and I just turn into one huge spot. So it is important.
Yeah, and that's something that, we'll look at. So once you've then looked at all of that with the patients and you've gone through all of that, what are some of the key products or ingredients that you will discuss and recommend to a patient with acne?
Okay, so main products if you're acne prone, salicylic acid is a key ingredient. It's a beta hydroxy acid, and it's well known for exfoliating the skin and helping to basically declog the pores. It's going to get rid of any oil, sebum, any dead skin cells and bacteria in the pores. So it's really good at cleaning them out. So that is a key ingredient if you are acne prone.
Okay.
In clinic, we personally like to prescribe 2% salicylic acid because we find this to be very effective. I personally use salicylic acid myself. Pore therapy is one of my favourite products, and the huge difference this has made to my skin is amazing.
Helps with pore size as well, doesn't it?
Yeah, glass skin.
Yeah, glass skin. And, I know that it is a favourite of yours often, you will have it. And it's also in a face wash as well, but you can also get the salicylic in a face wash.
Yeah, so a salicylic face wash and toner is a perfect combination if you're acne prone.
Okay, and then going on to things such as moisturisers and, there are patients often think, well, I've got oily skin, I've got acne, I don't want to put moisturiser on because I'm going to make it worse. Should they still use a moisturiser, shouldn't they?
Yeah, so obviously ingredients wise, you want to be using your salicylic acids. You also want to be looking at some form of antioxidant, like a niacinamide. That's also a really good ingredient. Treating acne prone skin, like you said, then you do need to be hydrating the skin. If some patients think, for instance, if I hydrate the skin, I'm going to get further breakouts. If you're using the wrong moisturiser, one that's too thick and rich, yes, you will. Yeah. But if you're using one that's not going to clog the pores, you're not going to. If you're not going to moisturise your skin and you're acne prone, your skin's going to be really dry and tight, and then overcompensate by producing more oil, which will lead to further breakouts. So actually moisturising the skin with acne prone skin is so important.
Yeah.
In clinic, we like to use, if you like a serum, the IS Clinical Hydrocool serum, that's really nice and lightweight. Or we like to use just a nice lightweight moisturiser like the Abaji Hydrate.
The Abaji Hydrate, yeah. And we look at the ingredients, don't we, within a product. And often patients are like, well, I've got this moisturiser and I spent £300 on it, and actually all it's doing is clogging the pores. It's not actually helping them. It's a marketing fad, a marketing ploy that unfortunately we do see a lot of our patients sucked into and taken in. So they've washed, they've toned. Do we offer a spot treatment at all? I know that we have our therapeutic lotion that can be recommended for some patients.
Yeah, so the ideal skincare plan is you're going to have your cleanser, which is very important if you're acne prone.
Question, how many times should you cleanse?
In the morning, I will cleanse once, make sure it's a 4-hour cleanse and massaging it into the skin, and then rinsing with lukewarm water. Not hot.
Why not hot?
because it's just not good for the skin. It damages the skin barrier.
Okay.
And it can cause inflammation.
Okay.
And strip the oils on the skin.
Well, I didn't know that one. So
Yeah.
thanks for that one.
Lukewarm.
Okay.
So yeah, cleanse the skin once in the morning and always double cleanse over night time.
Okay. Why double cleanse?
I double cleanse with the Abaji Gentle Cleanser. That's my favourite one.
Yeah.
It's important to double cleanse over night time to remove, for instance, makeup.
Mm-hmm.
And then your second cleanse is actually cleansing the skin.
Cleansing the skin. Okay.
Yeah.
Okay. So after we've cleansed, then what do we do?
A toner, some
Okay.
form of like salicylic acid toner, like I mentioned before, to help decongest the pores and help exfoliate the skin as well.
Yeah.
That's a form of chemical exfoliant because
Okay.
it is always good to stay away from abrasive scrubs as
Yeah.
well. And then some form of antioxidant, like a niacinamide, is perfect for the skin. It's anti-inflammatory. A moisturiser, very important.
Is that morning and evening, would you say?
Yes, moisturise morning and evening.
Yeah.
In the morning, after that, an SPF. As well.
Okay. Now this is what's the right word? A bone of contention maybe that we see with a lot of acne prone patients who'll say, well, I'm not using SPF because it, again, makes my skin oily. I've tried loads, so I just don't use it.
Yeah, that is very common. So normally when I say to patients, why is it that you don't use SPF? There's a lot of misconception. So like you said, then they feel like it causes further breakouts. They relate to SPF as that thick white SPF that you
leaves a
wear on
cast over your
holiday,
face, yeah.
and things like that. So actually SPF, if you're using like a mineral-based one, is not going to cause any breakouts at all. I wear SPF 50 mineral-based one every single day and it does not cause me any breakouts at all.
No, it's finding that right one. And I suppose that's what part of the consultation is, to help the patient find that right product for them.
Exactly. And also it's very important to find one that contains zinc oxide in, because it's also very healing on the skin.
Okay.
So if you're acne prone, that is an important point.
Yeah.
And yeah, a standalone SPF 50 doesn't count in your moisturiser or your makeup.
Okay. We have many patients come to us who are using retinols. Now, these aren't prescription retinols. These are retinols that are bought over the counter, and they find that they're still getting breakouts. It's maybe worsening their breakouts. Is there a reason for that? What would you advise?
Okay, so for instance, if a patient is wanting to rejuvenate the skin for anti-aging benefits, retinol is perfect. If you have acne-prone skin, you want to stay away from retinol and opt for a tretinoin instead.
Okay.
Tretinoin's actually in the NICE guidelines and it's proven to help treat acne.
Okay. And
So
tretinoin's prescription?
It is a prescription strength product, so obviously that would need to be guided by a doctor and prescribed by a doctor. Whereas some retinols can be bought over the counter.
Oh yeah, I've seen them in your local high street shop. You can get it in whatever, can't you?
Yeah, so if you are acne prone, tretinoin is the better option for that, and it is 100 times stronger than retinol as well.
Okay.
And it also does have anti-aging benefits.
Oh, perfect.
So it's a
Two in one.
perfect product.
It is.
Yeah.
And is there anything else you would introduce, into the evening? So I know tretinoin, your retinol is more of an evening use product. Is there anything else that we've maybe introduced for patients into the evening, or would we keep it the same?
Yeah, so another product that we didn't touch on before is actually benzoyl peroxide.
Okay.
That's a very important product if you are acne prone. Why? Because it actually kills P. acne bacteria. So it's key in your routine if you suffer with breakouts. I know a lot of people will be aware of benzoyl peroxide because they can go buy it over the counter.
Okay.
But that one tends to be quite tacky. The molecules are quite large, so it doesn't penetrate as good.
Okay.
And it can actually cause some further irritation.
Okay.
So in clinic, we prescribe benzoyl peroxide for patients. The molecules are very small, so it's very effective and you get results quite quickly.
Okay.
And it's not tacky, which is perfect.
Which is just what we want. We don't want anything, a sticky, you don't want to feel that, do you, before you go into bed? Okay, so we've touched upon our skincare. So we're looking for a good cleanse, and it's a double cleanse in the evening, a toner with salicylic, and even a face wash with salicylic, antioxidant of some sort. I know we didn't touch upon vitamin C. Now, vitamin C is a product that I have seen a lot on social media. We see it on your latest trends. But it's not something that we usually recommend for acne-prone patients, is it?
No. So vitamin C is a no if you are acne prone, ideally, because it can cause further breakouts. The same as retinol. They're two ingredients that you want to stay away from.
Okay.
Vitamin C is obviously good because it's got a nice brightening effect to it, and it's also anti-aging.
Yeah.
But you can get that nice brightening effect from your other antioxidants like niacinamide.
Okay. So you don't need to introduce a vitamin C. Your niacinamide is the ingredient that you're looking for, really.
Yeah, you can change it with a niacinamide if you want an antioxidant in your routine.
Okay.
And obviously, like I said, retinol's a no-go as well.
Okay. So we've talked about your sort of skincare. So what would be sort of next after your skincare? We're talking about in-clinic treatment. So what would we offer for patients?
So for in-clinic treatments, we genuinely recommend chemical peels.
Okay.
We have various different ones in clinic. So 20% salicylic acid is a great chemical peel to have. Helps decongest the skin and also smooth out the skin's tone and texture.
Okay.
Which is great.
Yeah.
TCA peels are another great peel for acne-prone patients that can really help with the texture of the skin.
Okay.
So peels are a great place to start with helping to decongest.
Yeah.
We also offer various different treatments for after we've got the inflammation of the acne under control.
Okay.
So this is more treating the acne scarring and pigmentation.
Yeah, that we often see patients are left with. And they may say, I had acne when I was 13 to 16, say, but it scarred my skin. And that's where we see a lot of patients sort of come to us at that point, don't we?
Yeah, so obviously the most important step to treat acne is skincare. That's the most effective and most important step. Then we can look at in-clinic treatments like your chemical peels. Then once the acne is under control, we can look at treatments like your microneedling radiofrequency.
Okay.
Which is a great treatment to help treat atrophic scarring.
Okay.
So that's indentations in the skin. So basically,
also known as like ice pick scarring.
Yeah. So basically what microneedling does, it's a great treatment. We get great results in clinic with it.
Fantastic results. Some of the results have been outstanding, haven't they?
It's so popular as well. And we also combine it with different treatments.
They have CO2 laser, which they can include as well, and which helps to resurface the skin, doesn't it? Take that sort of top layer off like a file. As strange as that sounds, sort of like a file that will help to really smooth out and improve the texture of the skin.
Yeah, Yusra describes it like taking a buffer to the skin and completely smoothing out the skin surface.
Yeah.
So obviously microneedling's great. We have standalone microneedling, don't we? And also microneedling radiofrequency.
Okay.
So obviously the difference with them two is the microneedling radiofrequency is 100 times stronger than the microneedling alone.
Okay.
It just depends on patient's budget and lifestyle, which treatment that they go with.
Yeah.
But they're both amazing, effective treatments that we can also combine with chemical peels as we're a doctor-led clinic.
Yeah. Okay.
So microneedling's one great one.
Yeah.
To help stimulate collagen elastin and basically remodel the scarred tissue.
Yeah.
CO2 is another great treatment in combination with that.
Yeah.
When we're treating acne scarring, it's always we want to combine different modalities to get the best results. Yeah.
We talk about a patient journey a lot through the clinic. You may start with treating your acne, but then we're going to treat you sort of once the acne is under control. And then it may be that after you've done all of that, we can then maybe look at if you're wanting to do other treatments such as skin boosters and stuff, which I know you'll touch upon. Yeah,
so obviously, it, like you said, it's a treatment journey. It's not one size fits all. When a patient comes into the clinic, their treatment journey is specifically bespoke for them. That's just how it works to get the best results.
Yeah, it's like if you went to the GP, they're not going to prescribe you maybe the same pain. Me and you may not get the same painkillers prescribed, for example, or antibiotics. It depends on the individual, and that's something that we take great pride in for our patients, making sure it's a really bespoke treatment plan. So if you and your friend came and both had acne, you may not get the same treatment plan because there may be different causes to your acne, maybe at different stages of acne. It could be that, there's just so many different factors, which is why it's so important to have that consultation with us, get the knowledge, get the plan, which are all backed and prescribed by Dr Yusra. She oversees every single treatment plan. And then it's really bespoke to your needs, and it's really going to help and benefit you. So
touching back on the treatments. So subcision with skin boosters, that's when an instrument's placed underneath the skin surface to help break up them fibrotic bands of scarred tissue.
Yeah.
And then obviously Yusra likes to go back in after with a skin booster to help improve.
Give that glow.
Yeah.
Give that nice glow
Improve
that we
the
like
skin.
in clinic. So perfect. So we've touched upon our skincare today. We've touched upon different treatments. So we've got the microneedling alone, standalone. We've got microneedling radio frequency. And then we've also got your CO2 laser as well. And then finishing off, our icing on the cake usually with patients is your skin boosters. And obviously the continuation of your skincare. It's important to continue the use of it. And we can always, once the acne is under control, we may be able to introduce or take away maybe certain products or slightly change things up depending on where you're at, and which is why, I know our patients are in constant communication with you and Olivia, our other therapist, and Hannah, updating you all the time of where they're up to if there's any concerns. So I'm going to finish with this question. What are 3 things, or maybe it's not 3, that you wouldn't recommend for patients who have acne?
3 things that I wouldn't recommend would be standalone microneedling if you have active acne.
Active acne,
So that's
okay.
when you have pustules on the face. If you're needling over them, you're just going to spread bacteria.
Okay.
There's treatments like Intracell, which we offer, that you can have if you have active acne,
Yeah.
but not the standalone microneedling pen.
Okay.
Vitamin C, as we touched upon before,
Yeah.
that's a no if you have acne, and a retinol, as it'll cause further irritation and skin purging.
Okay, thank you so much.
Okay.
Well, thank you so much for joining us today. It's been
thank
lovely
you.
having you, and I'm sure you'll be back on soon talking more things skin.